Oh my god. Ow, my stomach is hurting so much. Ow. Ow, ow. Oh, I didn't do that. Oh, hey, butterflies. Welcome back to our channel. Right now I'm in bed. My stomach doesn't hurt too good. I just feel like laying down. I don't know why my stomach's hurt. Yesterday my mom gave me peptide, but it didn't really work. And I don't know what's gonna happen. So I'm either just gonna, I don't know, go to pink completely and just let it go. I don't know. But it hurts so much. I don't even, I can't. She hasn't been eating well for the past couple days. So I'm gonna go find out because I don't know why she's not eating good. I mean, she's been complaining about her stomach. Hold on, did I say that? Okay, well anyways, let's go check up on her. Oh, hey sweetie, you. Oh, my stomach is hurting so much. Didn't the peptide help? No, it didn't. That's weird. Mom, can you help me? You're a doctor? Honey, I'm a cardiologist, right? And I wish I could help, but well, I do know some things about the stomach, but not enough to help you. I'm sorry. Wait, I have an idea. I know a woman who, when I were classmates in college, she could probably help me. I mean, it doesn't sound like a bad idea, no? I mean, she could probably find out what's wrong with your stomach. I guess, but what if she does something that hurts? No, they just touch your stomach and all that. They're just gonna make sure your stomach is okay. I hope we're not going to that new big scary hospital. No, honey. We're going to the small clinic because it's kind of more less crowded there than the hospital. Alright, Mom, whatever you said. Just go put on your shoes and I'll put on my shoes and I'll get my bag, okay? Okay. Hello there. Can I get an appointment with Dr. Of course. What's going on? Sorry. Oh no, it's okay. So, what happened was that yesterday my daughter got a bad stomach ache, and she's been complaining about it all day yesterday. And I'm not sure, but I gave her peptide, but it didn't really work. So I was wondering if we can put her with the doctor, just so she can see what's going on. It's Maria Butterfly. Okay, Maria Butterfly. Is this her correct date of birth? Yep, that's correct. Alright then. The doctor will see you soon. Just wait a few minutes. Oh, my stomach's hurting. I can't breathe. Oh, sweetie, you're being really brave right now. And I love you. We're just here to make sure that nothing bad is happening to your it didn't work for some reason. And she hasn't been eating much lately for some reason. And I always or sometimes I ask her if she's even sure she doesn't want to eat because she has like only a few meals a day. But she's not eating as much as she should. So I don't know if there's something wrong with her stomach or her digestive system or anything. I can see your concern, madam, and we're going to make sure everything is fine. So, sweetie, have you been feeling tired the past few days? No, not really. Alright then. How bad is your pain from 1 to 10 right now? Like a 7? Okay. So, when has this pain really started? Your mom said it was yesterday. Well, it started the day before yesterday. It actually started I can't even stop it. Okay, I understand. Just ignore the question. So, your mom is telling me you're not eating as much as you usually do. Is that true? No. Alright then. So how long? So, have you been doing peptides? Well, for the past week? No, she didn't tell me that her stomach was hurting. She wasn't eating as much as she should, though. Oh, I see. Sure, everything is okay. Because we gotta make sure that some of the body parts, like, for example, her head isn't doing anything to her stomach. So we're gonna do a regular checkup. So I'm gonna check her ears to see that everything, and then we'll just do the rest. Okay. I'm gonna check. This is kind of difficult to figure out. Have you been going to the bathroom more lately? No, I hadn't. Okay. Again, it could be something in your digestive system, but again, I don't think it is. Because if it wasn't the digestive system, it would hurt like right there. It hurts where my stomach is. It hurts where your stomach is. Well, oh, see. I don't even know what I'm saying myself. Well, her stomach, we can't really figure out what's wrong with it. Because, we would do an ultrasound, but again, we can't because we don't have any machines. The ultrasound machines. This is the small positive referral, so we don't really know what to do. news and then the bad news. So, which one do you want first? I think I want the bad news. Well, it's almost bad news, but unfortunately, you have a gallbladder stone. A what? A gallbladder stone. Wait a minute. Oh, I used to have that. I had that before. So it is very genetic in families. And it can happen sometimes. And it turns out that there's only like two or three stones in your gallbladder. So we may have to remove her gallbladder. No, I don't want to remove my gallbladder. Well, but you know what the appendix is, right? Yes. Well, the appendix is the part of the body we don't need. It's also like the gallbladder, you don't need it. And no one ever knew its purpose. Well, some people do, but I don't know. So we're gonna have to get your appendix and your gallbladder removed. And because we're kind of afraid that it's gonna happen to her again, and we don't want your stomach to hurt. And some of the symptoms are it could look like she just had a period, but that just means that, well, it's just extra blood that the body doesn't move. It comes from the area where we move the gallbladder. So what's gonna happen in the surgery is we're gonna make a little hole on your belly button, and the camera's gonna go all the way to your gallbladder and this time. And the appendix, just to make sure it doesn't look like it's about to burst, because then they have to remove it. And you can go home the same day. And you're not allowed to ask pressure too, because some liquid and blood can bleed, or could get out. So yeah. So we're gonna need a surgery. And because we don't want to take the risk of your stomach hurting so much, we're gonna postpone it to, what did I say? Postpone? Girl, you can't even say anything. Just like in college and how whatever you say, you say words. Hey. Sorry. Anyways, we're gonna schedule the surgery to next week because we don't want to take any risk at her stomach and her appendix bursting, and we don't want her to pass out. It could be even fatal, but it's okay because it usually takes a while for your appendix to burst. So we're gonna schedule the surgery to a day next week. I said that. So we have the whole week available. So which one would you like? I guess Tuesday? Yeah, we can do that. And do you want morning or night? I'm gonna say in the morning. Okay, so the surgery will be at 8 or 9 a.m. and she'll be out in like 30 minutes after the surgery. 30 minutes, and after 30 minutes she'll be out of the surgery, and then you can go home. So it's gonna be a really quick little operation. So nothing to worry about. So just like that. 6 a.m. in the morning. So right now we're gonna get to the surgery center, and then we're gonna do the roll. We're gonna register. I had make sure that no germs get in the operation. Okay, then. I'll give you privacy. Yes, we're done. Oh, this is the quick thing. I feel take off your shoes. Not with shoes. You can keep it. And unfortunately, you have to take off your bag. Or you can keep it on. I'll take it off. Well, not a doctor, but I'm so distracted today. Well, it's a person that works in the hospital. And shows kids what's gonna happen when they go in the operating room. I'm gonna go talk to the surgeon and tell him you're almost ready, okay? Hello there, I'm Emma. I'm a child life specialist. So I'm gonna tell you what's gonna be happening when you go into the surgery. So what is one thing that you're nervous about in the hospital? I've never been to a hospital before. set up your bubblegum scent, okay? Okay. I'll see you soon. Is this the my butterfly? Well, hello there, sweetie. My name is Sandra. I will be your gardener's observation nurse. I'm gonna be looking after you the whole time during the surgery. So, I'm gonna ask you some questions, okay? Any questions? Alright, so there's any questions? Well, I have a question, but it's for the surgeon. Go ahead, you can ask me. Is there any risk with any surgery that can happen? Because I had this before, I know that happened. But is there a risk that we should be aware of? No, there's no risk. Well, it's not the surgery will be only regular surgery. That doesn't happen. Well, it's sometimes it's most likely that she'll come out okay. And I'm gonna have Dr. Eric, the surgeon, come and talk to you, okay? Okay. I'll see you there soon, okay? Okay. This patient really is. Yep. Hello, I'm Dr. Eric. I'll be the surgeon. And you, little girl, is going to be so I'm gonna be your surgeon for you, okay? So I'm gonna speak to you and then you can be my surgeon. So I'm gonna ask you the same questions like what the anesthesiologist asked. And all of those things. Is there any, are there any questions? No. Alright then, so they're gonna come get her and then the surgery will start and then I have to go. Hopefully you understand everything that's gonna happen. Bye. See you next time. Bye. Way to take her. Give a kiss and hug your mom. Everything will end soon, I promise. Everything will be alright. After the operation, we're gonna go home, okay? Mask and it has a bubble gum smell. I want to put it on at 3, 2, 1. Ready to start. Just gonna use this. Okay. Alright, a little more pinch on this. Okay. We're almost done. Yep. So, the good thing is that the surgery went successfully. Well, you guys have braces on your legs. Anyways, so the surgery was very successful. And we were able to take out the appendix and the gallbladder and the stomach. And we were able to stitch up the areas that were affected. So she will have a little bandage on her belly button. And it's very important that there's no pressure on it because then she could then allow some blood or some and a liquid could come out. No, we don't want that. So she's in the same room right now, or she's in the there, and yeah, the prenup nurse will come out and have you sign some papers, and then I suggest you bring get a drink for her since her throat is probably gonna be a little sore. Thank you so much. No problem. It's all done, sweetie. You're done. It's over. Here you go. Have it. Was it successful? The doctor said it was super successful. Hello there. Welcome back, ma'am. So, ma'am, we need you to sign these papers, and then she can go home. Okay. Thank you. She can change, and then you guys can go home. Then I'll bring out a wheelchair, so she doesn't have to walk. I'll go get the car so she doesn't have to go. Well, guys, that's it for today. Make sure to like, comment, and subscribe. Then don't forget to go for I'm sorry that this video is kind of weird. It's just that I've been a little distracted. So in case you see some errors, it's just that I'm a little distracted. But anyways, I know I said it, but anyways, please make sure to like, comment, and subscribe. The notification bell for more videos. I'll see you in the next one. Bye, guys. Bye.